One of the most common sleep disorders is sleep apnea. This can be a mysterious term for many. So, what exactly is sleep apnea? It's a condition where breathing repeatedly stops and starts during sleep. Sounds scary, right? The most prevalent type of sleep apnea is obstructive sleep apnea, or OSA. This happens when the muscles in the back of your throat relax, narrowing or closing your airways as you breathe in. This can cause you to snore loudly or make choking sounds. Now let's talk about its causes. OSA can be caused by several factors such as excess weight, narrowed airway, chronic nasal congestion, and even habits like smoking. It's also more common in men and those over the age of 40, though it can affect anyone at any age. The symptoms of sleep apnea can be quite diverse. They range from loud snoring or snorting and episodes of breathing cessation to abrupt awakenings accompanied by shortness of breath, difficulty staying asleep, and excessive daytime sleepiness. Other symptoms might include attention problems, irritability, and even mood disorders. How is sleep apnea diagnosed, you ask? It's usually done through a sleep study where your breathing, heart rate, oxygen levels, and brain activity are monitored while you sleep. This helps doctors determine the severity of your condition and the best course of treatment. Now, untreated sleep apnea isn't just about snoring or feeling tired. It can lead to serious health risks like high blood pressure, stroke, heart problems, type 2 diabetes, and even depression. It can also exacerbate pre-existing conditions and negatively impact your overall quality of life. If you're experiencing any of these symptoms, it's crucial to seek professional help. Don't ignore the signs. Your health and well-being are important, and there are effective treatment options available to manage sleep apnea. Science has come a long way in understanding and treating sleep apnea. Let's delve into some of the enlightening research that has been conducted on this sleep disorder. One key study comes from the American Journal of Respiratory and Critical Care Medicine. In 2017, they found that moderate to severe obstructive sleep apnea was associated with a significantly increased risk of stroke, cancer, and death. These findings underscore the importance of early detection and treatment of sleep apnea. Another important research was published in the Journal of Clinical Sleep Medicine. This study highlighted the effectiveness of continuous positive airway pressure, or CPAP, therapy. Participants who used their CPAP machines for an average of at least 4 hours per night had fewer cardiovascular events and lower death rates than those who did not use the therapy or used it less. On the more innovative front, a study from the European Respiratory Journal in 2021 explored the potential of playing wind instruments to improve sleep apnea symptoms. They found that practicing wind instruments can strengthen the upper respiratory tract muscles, potentially reducing the severity of sleep apnea. From the realm of neuroscience, a study published in the Journal of Neuroscience in 2019 suggested a link between sleep apnea and changes in the brain's white matter. These changes could potentially contribute to cognitive difficulties experienced by people with sleep apnea. Lastly, a 2020 study in the American Journal of Physiology emphasized the role of lifestyle changes such as weight loss, exercise, and reducing alcohol consumption in managing sleep apnea. These studies, and many more, have significantly expanded our understanding of sleep apnea, its potential risks, and various treatment strategies. They highlight the importance of a multifaceted approach, combining medical interventions with lifestyle modifications to effectively manage sleep apnea. Research continues to evolve, offering hope to those suffering from sleep apnea. The scientific community is ceaselessly working towards better treatments and perhaps one day, a cure. While professional medical help is essential, there are also home remedies you can try to manage sleep apnea. Let's begin with some lifestyle changes. Sleeping position can significantly impact sleep apnea. Instead of sleeping on your back, try switching to your side. This simple shift can help prevent the collapse of the soft tissues in the throat, reducing the chances of obstructed airways and interrupted breathing. Next, consider limiting your alcohol intake, especially before bedtime. Alcohol tends to relax the muscles in the throat, leading to narrower airways and increased snoring. Cutting down on alcohol can help to alleviate these symptoms. Regular exercise is another key remedy. It not only helps to maintain a healthy weight, which is crucial in managing sleep apnea, but also strengthens the muscles in your airways, reducing their likelihood to collapse as you sleep. Even moderate activities like walking can significantly improve your sleep apnea symptoms. Now onto a surprising remedy, playing wind instruments. This might sound unusual, but playing instruments like the didgeridoo can actually help strengthen your throat muscles, improving your breathing and reducing sleep apnea symptoms. A study published in the British Medical Journal found that people who played the didgeridoo for about 25 minutes a day experienced fewer daytime sleepiness and snoring. Also, treating nasal congestion can also be beneficial. Congestion can obstruct the airways, causing difficulty in breathing. Using a saline nasal spray or a nasal decongestant before bedtime can help clear the nasal passages, promoting better breathing and a more restful sleep. The use of over-the-counter mandibular advancement devices, or MADs, can help bring the lower jaw forward and keeping the throat airway clear when sleeping. These oral devices can also be custom-made by a dentist, though they can be quite pricey. Another simple yet effective method is to elevate or prop up your head at least 30 degrees with a wedge pillow, which can prevent the back of the tongue to relax and fall back, causing an air blockage in the throat. A less commonly mentioned condition that may contribute to sleep apnea is silent reflux, or reflux with no symptoms, which is a form of sleep apnea. It is caused by acid refluxing up into the throat and can lead to hoarseness, coughing, bitter taste in the mouth, difficulty swallowing, swelling or irritation of the vocal cords, and post-nasal drip. Treatment involves staying off of the back and left side, being inclined, and treating acid reflux with the same methods as treating acid reflux of the stomach. Avoid sugar, eat whole foods, consume fermented foods, and practice good nutrition to improve digestion. Remember, these remedies should be used in conjunction with medical treatment, not as a replacement. Always consult with your healthcare provider before trying any new home remedies for sleep apnea. While these strategies can help manage your symptoms, they are not a cure for sleep apnea. Staying in regular contact with your healthcare provider and following their prescribed treatment plan is essential for effectively managing this condition. Sleep disorders like sleep apnea are more than just an inconvenience. They can significantly impact your quality of life, affecting your energy levels, mood, and overall health. When you're dealing with symptoms like snoring, daytime sleepiness, or sudden awakenings, it's crucial to seek help. This is because untreated sleep disorders can precipitate other health issues. For instance, obstructive sleep apnea, if left unchecked, can contribute to high blood pressure, heart disease, and even diabetes. Sleep studies can provide a diagnosis, and there are various treatment options available. From positive airway pressure therapy to lifestyle changes, there's a solution for everyone. The first step in your battle against sleep disorders is always reaching out for help. Remember, you don't have to face this alone. Medical professionals, therapists, and even online communities are there to support you on your journey towards better sleep. Turning a blind eye to the problem won't make it disappear. It's about taking charge of your health, and that starts with acknowledging the issue and seeking the right help. After all, everyone deserves a good night's sleep. Your sleep matters, don't hesitate to seek help. To recap, we've learned about sleep apnea, its causes, symptoms, and remedies. We've delved into the understanding of sleep apnea, a condition where breathing pauses due to blocked airways during sleep, leading to symptoms like snoring, snorting, daytime sleepiness, and mood disorders. We've explored various scientific studies, shedding light on how untreated obstructive sleep apnea can lead to other health complications, making this disorder far from just a mere inconvenience. Then we moved on to home remedies for sleep apnea. We learned that lifestyle changes can play a significant role in managing this condition. Something as simple as sleeping on your side, limiting alcohol, exercising regularly, treating nasal congestion, and even playing wind instruments can all aid in improving symptoms of obstructive sleep apnea. We also touched upon the importance of seeking help. A sleep study can provide an accurate diagnosis, and treatment options are varied and personalized, ranging from positive airway pressure therapy to oral appliances, upper airway stimulation, and myofunctional therapy. Remember, good sleep is not a luxury, it's a necessity. It impacts every aspect of our lives, from our mood to our overall health and well-being. If you or someone you know is struggling with sleep disorders, it's crucial to seek professional help. If you found this video helpful, give it a like, share it, and leave a comment. We'd love to hear about your experiences or any topics you'd like us to cover in future videos. Don't forget to subscribe to Remedy Seeker for more health tips and remedies. We're here to help you navigate your path to better health. Until next time, sleep well and stay healthy.